Hello and welcome back to part 2 of the AEMT Transition Protocol Update course for 2020. In this module we're going to cover the intraosseous review. Again, this is presented by Rick Pearson. I'm the Director of Education here at Lancaster EMS with permission from Dr. Michael Rehart, not only the Regional Medical Director but also the Service Medical Director. Should you have any problems, questions, or concerns regarding any of these presentations, please feel free to send me an email at richard_pearson@lemsa.com. So in this module we are going to discuss the added skills of intraosseous infusion for the adult patients. Previously this was for pediatrics only, and your scope of practice and your protocols have now increased to allow you to achieve access in 3 anatomical locations for the adult patient. And those 3 anatomical locations we'll see are the proximal tibia, the distal femur, and the proximal humerus. Please note that the distal femur typically is reserved for pediatrics due to ossification and calcification at that point. So at that point you're left with the proximal humerus and the proximal tibia. We'll be going in depth with Teleflex videos that I will provide links for you. In the video links underneath, if you go back to Blackboard, if you go underneath that, you will see where it says Teleflex videos, and I will have them listed in links for you. I'm unable to show them to you as part of this module presentation because the audio does not all play through. Please note when you do watch those videos, though, that there are some points in that where it is just animation, no audio. So as well as some other added skills as you are now able to, if your medical director allows it, as well as your service allows it, as well as you have training on phlebotomy equipment and things like lore locks and everything, you are able to obtain venous blood sampling from your IV site when it is related to a patient and a CVA. Please note this is very specific. Not all services and not all receiving facilities will take blood draws via pre-hospital. There are specific rules and policies that go along with that, and marking of your tube. So please know that, but that is something that is new, and depending on the service in which you work for, you may have further education related to that. But just to go over our anatomical locations, we see here the proximal humerus, left or right side, and all policies and procedures and clinical indications for insertion and contraindications relative to that are located in the extensive Teleflex education, as well as general education, referring back to your AEMT education. Distal femur for our pediatrics only, and the proximal tibials left and right. So here we have the links that I will be providing you in a mashup content folder in Blackboard, but they will be the proximal humerus site identification insertion from Teleflex, that is 3 minutes and 47 seconds long. A comprehensive overview site, again, that's 5 minutes and 44 seconds long. The third one will be the proximal humerus infusion fluoroscopy. That's a really short video. Please watch it. It shows you how quickly in a live patient, once you have everything set up for a humeral IO, how quickly the fluid and medication can be sent into central circulation. Following that will be proximal tibial site identification and insertion, a 5-minute and 55-minute video, as well as follow that up with another tibial site identification and a needle insertion, and then finishing up with distal femur site identification insertion. That'll be a total of 2 minutes and 54 seconds. So you will need to leave this module and go into the distinct videos again, which I have set up in a secondary content folder for you titled Teleflex videos, and you can watch them in any order. So that concludes this module. Please proceed to the quiz related to part 2. In this quiz you will be required to have access to your protocols, specifically as it deals with insertion of the IOs. You need 80% or greater required to continue on to Module 3 of completing that quiz, 10 questions, but please realize you do have unlimited access to those quizzes. So again, should you have any questions, comments, or concerns, please feel free to email me at richard_pearson@lemsa.com. And thank you.